Hard conversations are going on every day between doctors and patients. Will they be safe when they come to the hospital? On the other hand, death is an equal opportunity visitor. You're just as dead if you die of cancer as you do if you die from COVID. So we really have to balance meeting the healthcare needs of the community based on the resources, the prevalence, and the environment that we're in here locally.
We've been fortunate here and we haven't seen the patient surge that other parts of the country have seen. And so we at UC Davis Health have decided to continue to do essential operations, which would be injury, quality of life, cancer operations, and we've been doing those for the last several months. And Linda certainly has a cancer, and so that's something that you don't want to postpone.
I am the perfect storm to have lung cancer diagnosed at the same time there's this raging illness that attacks the lungs. Last fall, I, for the first time in my life, had a kidney stone. However, in my case, it turned out to be fortunate because when they were scanning to find the kidney stone, it just caught the very bottom of my lung where they detected this unknown dark spot. It was caught early, so I want to get it out as soon as possible, and for that I'm going in tomorrow.
Someone has to postpone a cancer surgery, there's always the chance that that tumor is going to get larger. There's a chance that it could metastasize. And so it's important, especially for us as thoracic surgeons, to get these cancers out when they're at an early stage, when the chance of cure is the highest. It's scary enough to have an operation, let alone to have it in the midst of a pandemic. So that factors into the decision making. I think for the most part, patients have been very understanding. Now we have preoperative testing for all of our patients, and that's good for two reasons. One is if the patient tests positive for COVID-19, I would delay the operation because there have been reports that those patients have a harder time recovering from surgery. And then if the patient tests negative, it's going to put your whole healthcare team at ease in terms of exposure. So there's a lot of benefit there.
One of the hardest parts about this that I'm being brave about is that nobody will be able to come in and see me. I would be lying if I didn't say it was really scary. And what they're doing is taking out an entire lobe rather than just taking the cancer and surrounding tissue. They're taking out the entire front right bottom lobe. My doctor says that after the surgery it will take 4 to 6 weeks to be healed. I will be in the hospital 3 or 4 days, so that has to take a while to heal, and I will certainly want to stay healthy as I heal.
My hero!
How are you?
I am so good. I am so good.
Looking good? You ready to go?
Thank you. I am more than ready. And if I had to put it off, who knows what would have happened.
Hard to say.
Different, but we don't have to find that out.
We don't have to know, we don't want to know.
No, we don't.
This is the lucky thing that I'm one of the people that gets to have surgery for a major problem, which would get worse if they didn't take care of it now.
Okay.
How do you feel right now being discharged?
Excited! It's great. And not only discharged, but then I got the free from cancer message this morning, so I have no more treatments, which is great.
While COVID is very important and we care about that tremendously, we also care about the rest of their medical needs, and we don't want people to put their own health at risk unnecessarily. And that all of our hospitals, particularly in this region, are prepared to take care of patients, because at the end of the day, that is truly the hospital mission. And I am hopeful that this experience, might help move the conversation in our country away from medical care as a profit center and more medical care as an important need for all patients.